Have an idea for the next $100 billion company. Physicians need better software for patient records. Current electronic medical records suck. If you could be the dominant EMR, you'd win. Just need a slightly better product and better health systems will jump in on it. Who is working on this?
Did he write that for us? Did he write that for Ursamin?
Hi, this is the Ursamin podcast. Here at Ursamin, we believe that people make better health decisions when they have all of the right information and education and data all in one place. So, Shannon, good to see you again.
Good to see you, Levi. Thanks for having me.
I think you have me.
Oh, yeah, that's right. I have you. Thank you for doing another one of these episodes, Levi.
Yeah, you're welcome.
Shannon Aylesworth, founder and CEO of Ursamin.
Today, what I want to do is we've been engaging with people, right?
Yeah.
Caregivers, helpers, people that are needing our services. So we've been engaging with them on the internet. And I found some quotes that I just wanted to share with you.
Yeah.
And get your response.
Okay.
All right. So
yeah,
that's basically fun. What we're going to do today.
It's like a pop quiz game show or something.
It's like a pop quiz game show.
Okay.
And so I think some of them are really, I think they're trying to be almost funny, but there's a lot of tragedy, right?
Yeah,
being a caregiver.
Yeah.
So
we were actually today. I was just talking to Lori, my friend, about her situation, and I kept laughing. And I was like, "I'm sorry, I don't mean to laugh, but in the face of the challenges and the silly stuff that goes on, that you just are like so shocked. The only thing you can do is laugh."
Well, it's just hard. Mm-hmm. So let's start with the first one. And again, I'm not going to use anybody's names here, but I'll share the images on the video.
Okay.
It says, "Help, I'm so burnt out."
Oh, yeah.
That was it. That's all they posted.
Oh.
Nothing more. Yet it says so much.
It does say a lot. That's a big cry for help. The question is, how do you help that? Burnout is huge. It's across the industry, right? I mean, I just was writing a whole article on provider burnout and then patient burnout. I saw that article. Mm-hmm. And then everybody's burned out. And the question is, how do you get resources? So there's things like respite care. And we looked at things like David's Refuge and other places. I think that's where, people are zeroing in. Actually, one advisor that we have, I was just talking to him, and he said they did a big survey, and the number one thing that caregivers need is burnout help is like respite care, taking care of me time. How do you prioritize? And usually what happens is you don't know when to say when. You don't know when enough is enough or what's your breaking point. What stuff can you get help on? You just do it because you love them. And so you tend to put yourself last in that situation.
Yeah, so. And I would say that this post is it was on Facebook. It embodies everything that I've read over and over and over again. I think they're just caregivers are just reaching out. Please help anybody.
Yeah.
And I think they just want somebody to listen to them too.
Yeah.
Because you almost got to be feeling alone.
It's very lonely. It's weird. You're alone. You're not prepared. It sneaks up, and all of a sudden, there it is. So, of course, you're alone because you don't even know that there's resources out there. You're just, we said, all of my friends at this age, we go, this wasn't my plan. I didn't plan to have my dad living in my house. Not that I don't love it, but, people are like, oh, you're a saint. I'm like, no, it wasn't my plan. I didn't think when I was a kid that this was the way my life was going to be. So, yeah, it's lonely.
Yeah. Okay, now this one's totally different. I found Stuart Blitz. He posted this on Twitter.
Stuart, a guy. Okay.
A guy. I don't know who Stuart Blitz is, but he's got a blue check mark, which could be like either paid for it or he's like
verified, professional Twitter.
He's pretty legit.
Can you be a professional Twitter person?
123,000 people saw this tweet. So he says, have an idea for the next $100 billion company. Physicians need better software for patient records. Current electronic medical records suck. If you could be the dominant EMR, you'd win. Just need a slightly better product and better health systems will jump in on it. Who is working on this?
Did he write that for us? Did he write that for Ursamin? We did not pay him. Are you sure that's a real tweet?
I'm looking at it right here. Yeah.
Wow. Yeah. Yeah. I mean, that's us. The challenge is that there's so much regulation and security and all that, and that's one of my diatribes is, do you blame the EMRs? No. Healthcare has changed in the first EMR was built, electronic medical records. For those of you listening, EMR is the electronic medical record. It's what creates a record every time you go in. And it was created in 1972 in a different healthcare scenario where you had acute terminal illnesses. You didn't have chronic illnesses. So our diet, everything that we've done from a health perspective over the last 50 years has changed, so the EMRs can't keep up with it.
And in 1972, I think I was born just after that. My mom still smoked cigarettes. I think it was pretty cool to smoke cigarettes when you were pregnant.
Oh, yes, when you're pregnant. My mother,
It eases the baby pain, is what I heard.
She had Manhattans with me, and cigarettes, and we have pictures of her rocking in the chair with the Manhattan on her belly smoking. But I think I came out okay. But it is a huge opportunity. There's a lot of fear. I will say that there's a lot of fear of change because patient safety is at risk if you make big technological changes. So we deal with that. We're getting a lot of good support from different organizations to make sure that we navigate that patient safety risk piece well.
All right. Well, there you go. So, Stuart,
we like you.
We're going to tweet you back.
Let's reach out to him, right?
Let's reach out to you.
Are we on tweet? We're on Twitter? Tweet?
Twitter? Yeah.
Okay.
Let's see here. Probably a little bit of a fun one here. And this one might resonate with you, Shannon, because you are a pet person.
I am.
Okay. It's long, so give me a chance to read it. And there's a lot of punctuation, extra exclamation points and stuff. So let me see if I can get through this here. I want to take my dogs and run away. My poor, sensitive nervous system just can't take it anymore. Frowny face. I hate living with her. I love my mom in an expected way, but I don't like her very much, and I'm starting to dislike her more and more. And then I feel extremely guilty because I feel this way. I was adopted and honestly never bonded with her as a baby child. And they already have special needs son who got all the attention more than me. I'm ad-libbing there. Mm-hmm. I left my home 24 years in another state and to be with her and help her take care of this house, etc. And then she got the cancer diagnosis, thinking it'd be 1 year, maybe a little bit more. But alas, almost 5 years later, she's still here. God help me. I can't do it anymore. I've put 5 years of my precious life on hold for her and don't get much thanks, to be honest. She's now in hospice because she's not getting any chemo anymore. But this lady may live another year knowing her. I feel trapped. If I were to leave her now and put her in hospice outside of the home, I would have to deal with the guilt of it for the rest of my life. Thank you for letting me vent.
Huh. That's a hard one. I think caregivers have to master that guilt. I had a post the other day that I got on and I said, we're doing it to ourselves. I did it. Why do you feel guilty? She'll be taken care of. She's not taking care of you. And if your feelings, and again, they're going through their own thing. That's the hard part, right? Especially like my dad, when I was dealing with him when he first lost my mom, I was like, listen, I know you're dealing with growing old. Now you're growing old alone. Your wife of 53 years. One of the things that I researched was they don't have, what is their future? At 78 years old, what is your future? That's what, aging parents, like, what is your future? She's got no future. Her mom might have mom-in-law or adopted mom a year. What kind of life is that? So I had to learn to sit down and do, like, let's put some goals together. Let's decide what's important to you so that you can get that done, which at least redirects them to think about their life versus just being miserable and on top of you. So I think things like that are really critical, and that's one of the things I was saying we have to add to our platform is help to the caregivers on things that you can do. Like I had nurses in my family who knew how to deal with people in hospice. Now, think about it this way. Put her in hospice. She's going to have people who understand how to deal with somebody in that mental state, and they're trained to help that person have a quality of life while they're dying. So you're not putting them in a mental asylum. You're putting them somewhere that somebody can help them better than you. So to me, that's like, you got to get rid of that guilt. Why do you have to own it? Put them where they are going to thrive. And in hospice, those people are trained. I got taught by a PA the other day. I said, there's days I want to kill my dad. I said, oh my God. He goes, well, there's this thing that they teach nurses called therapeutic fibbing. Just lie. And I'm like, I go, I know, but I can't, right? And all of a sudden I just lie. He's like, they teach you tricks. So again, be kind to yourself. Put the guilt down, because there are people who are trained to do this. We were not intended to be hospice people. I was fortunate to have 2 sisters to teach me how to do that and to let go of the guilt and say they're better off. They're like babies are better off with somebody who knows how to deal with that. So
Right.
I actually want to go post on that now and be like, get rid of the guilt.
Well, it's funny you talk about trained lies. As a professional Uber driver, I think we're all professionals, whether we've done it once or 1,000 times.
right.
We're professional Uber
Right.
drivers. But I lie to my passengers all the time. I mean, and I say I lie. A good example would be like this: I play music, and typically I let the previous passengers pick the music for the next passenger. And so,
That's awesome.
but if they pick Marilyn Manson, I'm definitely not sticking with that for the next passengers. So I just change it back to Taylor Swift, and I'm like, oh, look, they picked Taylor Swift for you, because they don't know who.
They don't know who.
They don't
Well, that's customer service, right?
Yeah.
That's awesome.
Yeah.
Yeah. Well, and that's where that's when they say, is it a lie or is it omission? Again, like with my dad, his memory has gone from, I used to say every 2 days, now it's 4-hour reboot time. And he tells me the same thing. And I get so annoyed. I'm like, yes, I know. He doesn't know he told me that. And so that's when he said therapeutic fibbing. Yeah, remember how smart you were, blah, blah, blah. And they feel good. And I'm like, but I'm too tired to do that. That's why putting somebody in hospice and or nursing home, and I'm not saying nursing homes are overcrowded, so I don't say that, but having somebody who is trained in that, loves that person has a high quality of life. What my dad feels when I get annoyed is he feels like a burden. He feels like crap. He feels like, and it swells and it builds. And so that guilt is not helpful for anything. I was fortunate to have a couple sisters who are in the nursing profession, and they said, put them with people who are literally trained to help that person.
Interesting.
Mm-hmm.
Subject for another podcast, but just thinking about it, AI, I'm a big AI fan, and what's going on with AI.
Yep.
As humans are being replaced with AI, I feel like nursing/caregiving will be a bigger human role.
How do you mean?
Well, and again, we can get more into it in another podcast, but I just think like humans are going to be looking for work. Like my previous life, I was an accountant and an economist, right? And I know AI is going to be much better at being in accounting than I will.
Oh, you mean people will have an opportunity to shift?
To shift.
Yes.
Like education. Like right now, there's like one teacher for every 30 students in a classroom. But as humans are going to be looking for more work, we're going to put more emphasis on teachers.
Yeah.
Or more emphasis on probably caregiving and stuff like that. We'll be able to spend more time doing human-to-human things.
Yes.
As opposed to like our brain power type of thing. So just note that. All right.
Yes, 3.2 million shortage in the medical community in the U.S. So, yes.
All right. So Emily Tucker on Twitter, she said, and 1,000 some odd people saw this tweet, I just got my medical records, and they are 607 pages long. Wow. And now here's the thing about it. Emily Tucker looks really young. She doesn't look like she's a very...
Oh.
She looks like she looks like she's in her 20s.
She shouldn't have 607 pages of records.
Yeah, I mean, like if you're...
Yeah.
Yeah. So you laughed, right?
Yeah.
What is 607 pages? What do you think?
True. True. 15 pounds of paper. Yeah. I was. Again, I'm always writing something. Yeah. It's because there's probably 595 pages of crap you don't need. It's computer generated reports that have codes that speak to billing systems and claim systems, and there's all these different people who have to have that data, and the systems aren't able to clean that data up for you, which is what we do. That's why we're like, hey, this will be hugely valuable because we can take that 607 and distill it down to 20 pages of data that you care about. The EMRs can't do that today. So, and they're billing and claims. So everything has to go through the process. You have that data no matter what, because anybody who touches that data has to have their information. So if you imagine there's 12 people looking at the same record, it's got to have 12 people's required information. She's going to get 12 pages per thing. So, yeah, I mean, for young, you're like, wow, she's probably had some issues, I'm sure. But
Well,
There's repeats too, unfortunately. Like they shout out to say, give me the records, and everybody sends the records back, and it can be duplication of records. There's no.
yeah, I don't know. Yeah, like I say, who knows what their profile pictures are, but Emily, 607 is a lot, but it is common.
Yep.
There you go. I got some more of these. Again, this is just so common. I'm so mad and frustrated and done. I can't even write it all down. Please pray. Again, you laugh, but it's not laughing out of irony or sadness or whatever, but it's please pray a prayer of strength for me. And again, this was just a Facebook post, so in one of the private groups. But I was thinking about like this idea of people feeling stress. And now, this is a chance for you to do a plug for our software. How do you feel our software, Ursamin cannot solve the medical need.
Correct.
It cannot solve probably the emotional needs or the hurt from previous relationship aspects or anything like that. But people are mad and frustrated, right? And we're going to be mad and frustrated because they have dementia or whatever, right?
Yeah, you're angry at the disease.
Or we're cleaning, poop and pee and whatever. It's just horrible stuff, right? That has to go with being a caregiver. But what types of frustrations could we alleviate?
Yeah, that is a plug. And we just did that for our AARP pitch. We said, listen, there's 4 types of caregiving tasks. They're called IADLs, activities of daily living. I can't remember what the I stands for. There's nursing tasks, which we can't do. But there's this other task that is mind-numbingly boring and stressful and time-consuming and can be costly. But what it takes is your time, and I even just saw this last week with my dad, where I had to spend an hour doing paperwork by the time we got to basic questions he had for me on his bills. Right. I was at my wit's end. I was like, oh my God, I'm exhausted. I don't have time. That's such noise in your head. So calendars, scheduling appointments, pulling together the records, tracking what's going on, being prepared to talk to the doctor about an update. Those are things that one of the things I researched last week we're going to add is called patient-reported outcome measure. The providers want updates before you walk in their office that say, here's what I did in the last appointment, here's what can happen in the next appointment, here's what progress we've made, so that when you go in, you're prepared to have a great appointment, and then they immediately get treatment and move forward. We can do all that with the platform that takes all of that workload, collection of records, calendar, care team, all that. So the administrative piece is really... I think like we did that survey and we probably saw it was like 12 to 15 hours a week that people spend on minutia stuff that it's easy. It's not everybody can do it, but it takes so much time by the time it comes to building any sort of quality of life with your loved one. It just doesn't exist. You're too tired.
I'm not at the place where I have to physically care for my parents yet. And like I say, I'm not in that space with my children or my wife or anybody else. But the more and more I'm involved with our platform and in this industry, I feel like this looming doom over the horizon. It's just... Do
you feel it yet, Levi? Do you feel it?
Oh, man. Where did Levi go? He just disappeared. I'm off in the Himalayas. I don't know.
You know what's interesting? And that's telling. If we can raise the awareness of the men in the women's life. Because again, it's natural. Women are naturally nurturing.
Sure.
That's what we want to do. We love that. Honestly, we feel needed. My mom felt needed. It's what we do. So we own it. We don't always want you in it. Get out of my stuff. If we can raise the awareness of the guys saying, what stuff can I help with?
Right.
Like this admin stuff. Listen, buy the app. Fill it out. I'll tell you, my dad, I was just saying this earlier, if we teach him how to add a care team, he will go in the app. He loves this stuff. Go in there and just fill out his doctor's information. He's got nothing else to do. He's sitting in front of his TV. Here you go. Here's all the doctor's information. So the next time your wife or your sisters have to call the doctor, it's right there.
Right.
So that's, anyways. So when you said that, I'm starting to feel this loom. I'm like, see, we need guys to think that way because we're like, listen, it is coming. And women are like, I feel guilty. I don't want to complain.
No, it's...
And I'm like, I'm complaining. I'm a bad daughter because I'm complaining. No.
All right. Well, last one.
Okay.
This was kind of interesting. Another Twitter tweet. It's got 2. So Stacy, she said something along the lines of, then don't read the package insert. I don't care. The point is you have to read everything. the right, or you have the right to read everything. And then so Dr. Naomi Wolf, this is the tweet I wanted to get to. She says, people need to understand that their medical records belong to them. And every question they have of medical providers about proposed treatment, by law, the providers must answer. So I just saw
that is true.
And I was like, but we were talking, I think, a few podcasts ago about struggling to get our own medical records from the hospitals. This is a fight.
This is a fight.
Yeah.
It's a fight. There's two things going on. Old school medicine is, because it was such acute terminal care, scaring the patient with that data often because you don't understand what's in the records. It's not like it's in layman's terms.
Right.
You don't get a record that says, hey, you have cancer, but by the way, it's not that bad. You get a statement that says you have cancer and you have, here's the things that, if you had education, and here's the things, it's not that bad, it's level 2, here's the things to research, not a big deal. That's why they want to see you face to face. That's why they don't let that stuff just immediately go. There's that. And then 2, there's the fighting, which is people see that as an asset for them because they know you better. And
we say people.
The hospitals,
Yeah.
the hospitals. And there were old school doctors who also thought, well, you're my product, Levi. You're my product. Why would I give up those records? And they are. They're legally obligated to share it, but it's been made very difficult in some scenarios. I'm going to say in some scenarios, because we still have this retiring group of doctors who kind of fought for, again, when there was less doctors and more patients, more doctors, less patients competitively. Now we have way too many patients and not enough doctors. So now you see this flip of give them their data. They have to absolutely need control of their health. We need them to control their health because they're all going to end up in the ER if we don't.
Interesting.
Mm-hmm.
Well, there you go. I have a few others, but I think we can just kind of like sum them all up into like kind of 2 buckets. If I were today is like medical records. And I know, you get frustrated because we always talk about medical records, but I think that's the one thing that a lot of people, at least I know I can wrap my head around at least, because medical records means data and all this other things, but it's complicated and we have to get access to it, right? It's ours, right?
It is, yeah. I only get frustrated because honestly, the investors and everybody who's looking at it, there's, what do you want to do with the data, right? It's like what everybody fights over it. It's just a
Well, I think that goes to the second
battle.
part to it. What do we want to do with the data? We don't really want to do much with the data. We want to empower the caregiver, the patient.
Who are you
it.
enabling?
That's
That's what they say is, who are you enabling? Who are you doing this for?
That's right.
And then the battle comes down to, are you doing it for patients? Are you doing it for providers? Are you doing it for payers? And there's lots of conflicting business models that, it's who are you helping at the end of the day with that data? Once you've passed that step, then things get a little bit easier.
Right. And I think, your story and just kind of the people that we've connected with in the caregiving side is our heart, our compassion, our empathy goes out to the caregiver, and the caregiver is a broad term, it could be a mother or a father for a disabled child, or it could be, your elderly parent. There's a lot of different scenarios.
There's 2 million teenagers taking care of their disabled parents.
Right. There's just so many scenarios.
And you're like, let's just help these people.
Right. And if we can get them all of this data, all of their records in a clean, simple way where we can now engage. And again, I go back to my own scenario. I think just a couple of weeks ago, my father had surgery and my sister just had to start group texting everybody.
Yeah.
And it's like, I wasn't understanding it all. But if there was an app where I could just go in and just look, and there is an app, Ursamin.
Yep.
But I could just go in and look, he saw Dr. whoever Smith, and Dr. Smith said, I could read it on my own, and then I could.
And what's really cool?
I could put a thumb mark. I read it.
Listen, you read it, and then it says, and then our platform will then go, and this is what this means.
Right.
So that's the key. Like, again, the person who is living it gets it the best. They used to say, Shannon, you have to go to the hospital. I was like, this is my whole life. I can't be. And they're like, well, tell me what to do. They're all nervous. Again, we talked about that the last time, being the secondary caregiver. And if right there you've got education, hey, here's what happened with dad's surgery. Boom, here's what we learned about it. Boom, boom. Now you get the chance, and you don't want to bother them to say, well, what does that mean? I mean, my sister-in-law wrote 3 pages of notes. I was like, oh, my God.
Well, they even calling my dad. Hey, what's going on?
Yeah.
I'm in pain. I'm like, what kind of pain? Well, I'm just too tired to talk to you.
And then you're not caring, and you're...
Well, it's like, fine. Well, I don't want to talk to you either.
Well, they're tired. They're patients, right? This is the big thing is like, okay, let's put it on the patient. My mother used to get phone calls that she had to repeat her story to 6 children. She was exhausted and
That's right.
feeling bad, and everybody's worried. So we try not to call her. And I don't know. I lived it. I feel like while we talk about caregivers, this is all about enabling the patient, pulling the weight off the patient. The patient doesn't feel good when the caregiver is angry and upset and burned out, and it's going to be worse because there's such a shortage in the medical community. We're going to have to take on more and more. So if your final days of your life, like my mother, we were fighting all the time. That's terrible. That's terrible. That's terrible. That makes me, now you're going to get me angry.
That face is going to go on the internet.
It is,
there.
isn't it? I'm like, you're going to get me angry. Here we go. Don't get me started on I was so angry for my mother because she was just crying all the time. And yeah, I'll either get angry or I'll cry. I don't know which one you want.
Oh, neither.
Okay.
Neither for today.
Yeah, Shannon Aylesworth, founder and CEO of Ursamin.
And my name is Levi Spires, content creator, marketer, Uber driver, friend of Ursamin. So again, at Ursamin, what we really truly believe is that people, patients, caregivers, everyone has access to all of the information. They can make better health decisions. And I wanted to just put a plug in here is like, it should simplify.
Yeah.
And so you could spend just more quality time with the people that you love.
Thank you so much.
Thank you so much. Thanks. Bye.
Thanks.